We are with Karin Carroll, the Director of Public Health for the City of Gloucester. Hi, Karin, how are you?
Hi, good. Thanks, Heather. How are you today?
And this is supposed to be the week of the surge. Can you tell us how things are going in Gloucester?
Yeah, I can. You've probably seen our numbers did rise quite a bit in the last week, and that's largely due to an opportunity to provide widespread testing for some of long-term care facilities as well as some group homes, that type of thing. So anytime we have that opportunity, we take advantage of it. It's considered best practice in any kind of outbreak. We want to know, we want to identify who has the disease. And in this case, so many people have it without symptoms, so it makes it really tricky. That's why the testing is critical. And then we can better isolate, prepare, protect. Every step of the system can know that there's a potential, number of people that may or may not get sicker, but can certainly then expose others. So we do a lot of the isolating and quarantining at that point. So that's part of the reason for the numbers. The other part is this is the week, like you said, that the whole state is continuing to see a rise in case numbers. I think the good news is that the numbers are not increasing as much each daily. So the number of new cases each day has been coming down now for about 4 or 5 days. This is exciting, but we're cautiously optimistic. And, but the overarching number is still increasing. So you're right, we're still leading up to the peak or the highest number of cases in Massachusetts. But in terms of the ability to cope with that, and that's really the main indicator, is how our hospitals are doing, the capacity of our health providers in town, and we are within, capacity. So that means our ambulances still have, plenty of staff, plenty of ambulance. They're able to cope with the call volume. They're able to get people transported to hospitals where they are able to be cared for. We have enough beds, we have enough PPEs, and we have enough staff in the health department and to do this tracing and contacting that's so important for patients as well.
Were there any surprises when you were doing the testing in the senior facilities? Were you seeing larger numbers than expected? Were you seeing asymptomatic people?
Yeah, I don't know that it was a surprise. We certainly found asymptomatic cases, and a significant number of them. But we've seen this throughout the world, that this is very common with this disease, that there are people who have it who don't have symptoms yet or may not ever get them. So yeah, it's always interesting, and for me, I just appreciate knowing the information up front. I think we're then in a much better position to work with all our partners and know where and how things might unfold, and that's just really important. The more heads up you have, the better chance you have of getting people the resources they need, the education they need. So you or I might be asymptomatic and not worrying too much about life. We feel good, we look good, but if we received information today from a public health nurse that we were in fact infected or carriers, we would be much more careful where we went, what we touched. We would be watching our own health signs and talking with our own providers about what we should be doing or not doing. So it's just an important part of it, and it definitely changes how you approach if you do know that you are carrying something that's infectious to others.
We talked to Jim Destino yesterday about just city operations, and he talked about the need for testing citywide. Excuse me.
Yeah.
How do you feel that is coming along?
I think it's been better. I spoke with one of our medical practices this morning, and they are having an easier time referring their patients for testing, which is great. We're really happy to hear that. That's what we had been seeing and hearing anecdotally as well. And issues come up around how to get people, if they don't have transportation, how to get them to this testing. So these are now the second lot of problems that we're having, but we'd rather have these problems and figure out things like transportation and whatnot for everyone that needs the test to make sure they can get it. There are definitely more opportunities locally, and in Danvers there's a big outpatient center. There's one in Beverly, urgent care. So depending on the healthcare provider, they're referring to different test sites. But we are seeing that the tests are more available and they are coming back more quickly. So that's excellent too. Yeah.
Does that data come to you as a director of public health? Testing positive?
Through the state database. So if there is a confirmed case, there's a case made in a system, a computer system called Maven, and that's managed by the nurses. So generally speaking, I do not go in there because I'm not managing the case. We try very, very hard to limit the access to patient information to only those people that need to know that information. So, you know, unless there's something specific I've been asked to look into by the state or some other issue, I tend not to log on to that system. Our nurses do that daily, but they also get an email alert every time there is a new case. So we can see that. I can also see those email alerts, and there was a few weeks ago that those alerts were going off really quickly, and it was scary. They're now slowing down. I understand this morning there were no new cases since, you know, yesterday afternoon. So we're really cautiously optimistic that this is a good sign. Things are moving in the right direction. The numbers are starting to come down. But again, we plan to do more testing in the community as it becomes available to us, and of larger facilities, and that will start to show more numbers. Also, you're probably aware that grocery store workers have been given the opportunity to get tested as well down at Gillette Stadium. So even though they're tested in down at Gillette Stadium in Foxborough, if they're a resident of Gloucester, they'll be reported in our database to our nurses to follow. So we may see a spike there as well, or some numbers from that testing. Yeah.
Karin, I was going to ask, can you touch upon the presence of the National Guard in Gloucester now?
Sure. I think they've come a few times to Gloucester. One, they have a program for testing for long-term care facilities. Facilities can request them to come. They bring supplies. They do the actual testing. They've also been to Gloucester, I think this last weekend, to deliver supplies. So there's a whole process and chain of command in the city that if someone needs something, for example, if our firefighters are running short on masks or gloves, we request it through the state, through MEMA, and then they fill that order. And sometimes they literally drive it here, which they did this weekend. Other times it gets shipped to us. So it depends what it is. Yep.
Gotcha.
More long-term care facilities will be requesting the National Guard to do testing. Will that be something?
Possibly, yeah, possibly. Yep. If they can, and if it's still available, and the state has another program as well for long-term care facilities. So there are a lot of opportunities for either the National Guard to come and test, or for kits to be supplied by the Department of Public Health. And the facilities can do their own testing if they have the equipment and the staff trained to do it properly. So those are both options that are now available for people.
Great.
Yeah. Yeah.
Great. Well, we
So
appreciate
in
your time,
general,
Karin. Yeah, it sounds like there's some encouraging news all around.
I think so. And I think the fact that people have taken these warnings really seriously. People are wearing their face coverings throughout when they go to get their sandwich or they go to the grocery store. We appreciate that. The workers appreciate that. We know it's an inconvenience. You know, and people are continuing to follow the orders and the requirements of basically anything non-essential to don't do it, stay at home, stay out of the way, and give this thing a chance to settle, and that will help protect all of us. So we're really pleased that the community has stepped in as it has and is following the orders from the governor and from our local health department and helping us to fight this thing and get through it. But yeah, I am optimistic. You know, I think we have to be, and hopefully the more we go through this, the more we learn about how to treat the disease, what works, what doesn't work. There's some setbacks in that as well. Things we thought would work don't, but you have to do that with any new disease. And we're doing that process nationwide, worldwide. That's happening. So we're learning from each other and staying optimistic that we'll, you know, be able to resume some kind of normal sooner rather than later. But we'll see.
Well, we certainly appreciate your time, Karin, and we will definitely be in touch soon to see the latest news. And it's been great chatting with you again.
Great. Thank you. And anytime. Take care and stay healthy. Bye-bye.